Hi there, I'm Dr. Mint. I'm going to be taking care of you today. Before coming in here, I was reviewing your chart notes and I saw that our reason for visit today was vaginal discharge. Is that correct? Okay, so before we hop right into questions about that, I am going to take just some general vitals, check your heart rate, breathing, temperature, things like that. And then I'll get into asking you a little bit more about that. And I know this is obviously a very personal issue, but I'm so glad that you came in and this is a safe space and that your health is of the utmost importance to us. So we want to make sure that we take care of you appropriately, okay? All right, so to begin, I am going to check your heart rate. So I'm going to listen to your heart with the stethoscope. Let me just get this in here. And I'm just going to have you breathe normally. I'm going to listen to your heart rate, okay? Good. Okay, good. And now I'm going to listen to your breathing. Have you had any problems with your breathing or any diagnosis like asthma? No? Okay. So I just want you to take a few deep breaths for me. In and out. And then in and out. Okay, and on the other side, and in and out. And in and out. Good job. Okay. Next, I want to get a temperature reading for you. So if you could just open your mouth and stick out your tongue. I'm going to put this right under your tongue, okay? We're just going to hold that there for a moment. Okay. Temperature looks good. Out of here. And I'm just going to check your eyes. So I'm going to have you look straight ahead and do not change your eye positioning. Just look straight ahead for me. Good. Good job. Good. 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 Okay, now follow the light with your eyes. Good, and back this way. Good. That way. Good. 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 Good job. Good fluid movements. Okay. So everything is looking normal so far, so that is good. But tell me a little bit about this discharge. When did you notice a change? So about 2 days ago? Okay, and what was off to you? Was it the color, texture, maybe smell? Okay, color, it was a little yellowish and a little thicker than normal. Okay. Have you noticed any pain or itchiness or tenderness in the area? You have a little bit of inflamed. Okay. Yeah, so my hunch, just with those few things, would be a yeast infection, and that's a very common thing that many women go through. It's about 3 in 4 women will experience a yeast infection in their lifetime. And now a yeast infection is not considered an STI, so it's not a sexually transmitted infection. It can happen from a variety of different causes. Let's say if you were on an antibiotic recently, if you've maybe changed up any soaps, if you started using a scented product, that can kind of throw up the vaginal flora, so the vaginal bacteria in that area. And it's a rather sensitive ecosystem, so things, little things can mix it up. For example, if you have a weakened immune system, if you were diabetic, could also make changes in that bacteria, and once that bacteria is out of whack, the yeast will be produced, and then that can cause that kind of itchy sensation and kind of a painful sensation. Have you been having any pain when urination? Okay. Yeah, so some women do experience a little bit of pain. I would say like burning, nothing super intense, but there can be some painful urination. Have you had noticed any pain during sex at all? Okay. Yeah, well, again, that's one of the things that some women say is one of their symptoms, but not all. But usually definitely just kind of an itchy change in discharge. So what we're going to do then is a pelvic exam today. So I will be taking a swab of the discharge. So that's going to mean I will be using the speculum, and we will be looking inside your vaginal canal and taking a sample from there with a swab. And we'll do 2 samples of that discharge, and then once that gets sent off to the lab, that'll just confirm whether or not it is a yeast infection. But from what you've been telling me, it seems like that is the case. Have you noticed, so another thing that can happen with yeast infections is it can coincide with also having like BV, which is another virus, again, not an STI, but once that bacteria kind of gets thrown off, it can throw off other things too. And BV, have you noticed any smell associated with the discharge? It can be described as kind of like a fishy scent. Okay. Yeah, no, all right. So we will check for it just in case, because it is another common infection that happens when people get yeast infections, but not always the case. It could just be a yeast infection. Okay, so what this means is we will be doing a vaginal exam. So I will step out of the room and give you some privacy. And then I'm just going to have you undress from the waist down and lean back on the table. I will then come in. We will insert the speculum, so that if you haven't seen it before, is like a duck-billed instrument that will get inserted into the vaginal opening and open it up so that I can see it. So basically, if this was, say, a vaginal opening, it gets inserted and then opens so that I can see inside of here. And then we'll take a look, and I will do just a visual examination, a little bit of a pelvic examination where I insert my 2 fingers, and then we'll do some palpating on your stomach. And I'm just going to again be checking for any painful areas. And I know you said you've had a little bit of irritation and pain on the outside, on like your vulva area. Okay, so we'll look at that and then get those swabs, get them sent off to the lab, and depending on what we see in there, I will get you a prescription for either antibiotics or a cream or a pill to treat the yeast infection. Okay, perfect. So let's begin. I am going to step out and I will be back shortly. Hi, ready for me to come back in? Okay, so I'm going to start preparing. I'm going to get gloved and masked up, and you can just sit back, relax for a moment. So let's get my hand sanitizer. Do you have any idea of what may have caused it? Again, like scented products, douches, things like that could cause it. Have you had any recent antibiotic use? Okay, you did have a cold earlier that you went to the urgent care for. They prescribed you. Okay, so I'm starting to think that it might be that antibiotic use. How long ago was that? Okay. Yeah, so it might be that that antibiotic threw off your bacterial balance. And again, completely natural. There's nothing to be worried about, ashamed about. Like I said, yeast infections are very common. Okay, so get that. Let me grab my mask. And then my gloves. So to begin, we are going to start with the vaginal examination. That's where I'm going to be inserting my 2 fingers and I'll palpate on your stomach. And it'll be really brief, and I just want you to let me know if you're feeling any sharp pains at all. And I'm going to be checking for any firmness in that kind of lower pelvic region, just to see if your ovaries are doing all right. And I'm again looking for any firm spots, any bumps, lumps that shouldn't be there. Okay, so I'm going to apply some lubricant to my fingers. All right, and now I'm going to insert my fingers and palpate your lower stomach region. All right, so just lean back, relax. Okay. Good job. Any pain there? Everything looks really good. I didn't feel any areas, any lumps, bumps, anything. Your ovaries were all doing really well. So what I'm going to do is switch out to a different pair of gloves. I will insert the speculum and we will get the next portion of the exam ready and take some swabs. Okay, so I'll be right back. Okay, I have the speculum all inserted. Now I am going to take sterile wipe and we are going to wipe down the outside here. It'll feel a little cold, but yes, I am noticing that discharge that you mentioned. There is quite a bit of it in the vaginal canal. Again, that's totally normal, so I do believe this is going to come back as a positive for a yeast infection. There we go. And I am noticing that inflammation on the labia and vulva folds. So I'm going to start with grabbing one of my swabs, and again, still just cleaning off the area. You might feel a little bit of pressure and a little cold. Again, this just has another cleaning agent on it to just sterilize the area so that I don't get any contamination when I remove my swab. So is there any pain, irritation here? It looks like you have some swelling and redness here, as well as over in here. There's some swollen tissue there. Any pain? Okay, yeah, it does look like things are pretty inflamed. I'm so sorry about that. We are going to get this taken care of as quick as possible. Okay. There we go. All right. So I'm going to begin to taking my 2 samples. I am going to be using an instrument to get a little deeper into the vaginal canal, okay? But again, you're only going to feel a little pressure. So let me prepare my instruments. One moment. So I'm just going to take a swab from deeper in, and we're going to be doing 2 swabs, okay? So let's just get in there. Definitely a lot of areas of a thicker discharge. We just want to make sure that we're taking a sample from each wall and make sure we're getting a good look at all of the bacteria that's in here. Okay. Good, good. Okay, now remove this one. Get that into a sample jar. Okay. And then our next swab. Okay, now we have our next swab. We're going to again make sure that I'm collecting a sample from all over the vaginal canal. Alright. Okay, I'm going to remove the swab now. We'll get that into another specimen jar. Perfect. So now I will be stepping out of the room. That concludes all of the testing and samples that I need to take. So I'm going to step out of the room so you can get dressed. If you need any, there's also like wipes over there if you need to wipe off any of like if there's any lubricant or anything before you get redressed. Okay, so I'll be right back. Are you ready for me to come back in? Okay. So from what I observed today, it did look like there was a lot of discharge, and I do believe it's going to be a yeast infection. We will get the results back from those swabs tomorrow. They should be back in by midday, so if you don't get a call by lunchtime, please call the office and we will get those results to you. Because I do so strongly believe that it's going to be a yeast infection, I will prescribe you the medication for that. So we have two options. The first one being a vaginal cream. That is a cream that you're going to insert into the vaginal canal. You would do that at night just so gravity and things like that, it's not coming out at all. So do it as you are going to be laying down sleeping through the night. Or we do have an oral option, so a pill that you could take for a few days as well. Okay. So we'll call the pill route. Yeah, generally that's what most people choose, but I do, like to ask, make sure you know that you have options with this. So I will prescribe you that pill, and you can go take that to your pharmacy, and you should be able to pick it up today so you can start your course of medication. And that should hopefully get you some relief coming in the next few days or so. So, like I said, when we were speaking earlier, I do believe this is related to your recent antibiotic use. It can just throw off the natural bacteria that we have in our body, and when that gets kind of thrown out of whack, things can get crazy and start producing things that they don't need to be producing. So that's how you get a yeast infection. It's nothing to feel weird about or ashamed about. It is a totally normal occurrence that happens to pretty much every woman in their lifetime at least once. So thank you so much for coming in. Again, if you have any questions for us, please feel free to call the office. We should be reaching out to you with those results by phone. And again, if you don't hear from us, please do call and we will get you those results. All right, thank you so much for coming in, and I do hope that you start feeling better really soon. Bye-bye.